Yeah. So your time starts now. Yeah. So this is a 5 years old boy, Ravi. Do a general physical examination and proceed.
Okay, ma'am. I'll enter the room. I'll introduce myself. I'll wash my hands, introduce myself. Hello, this is Dr. Moniza. I'm one of the doctors over here. So, do I have the permission to
Doctor.
examine you?
Yes, yes, doctor, sure.
Yeah. So, hello, Ravi. How are you doing?
I'm fine, doctor. Thank you.
Okay. So, how's he? How's his the dimensions, height, weight, and anthropometric measurements?
Ravi looks slightly small for his age.
Okay. And any dysmorphic features present?
Mm, you can see him like this.
Okay. Okay. And there are no devices around. And yes, he looks small for his age and obese for his age. Okay. And yes. So, is he able to communicate? Is he talking? Hello.
Yeah, talking
Does
with
he
you.
speak well?
Hello.
Okay, he's well
Yeah.
alert and communicating well. Okay. Okay. Ravi, can you please walk for me? Can I
Yeah,
just
he
see
is
his gait?
walking. He
Okay.
seems to be walking normally, not put any
Okay.
abnormal gait to how he's.
Okay. And can I just uh, take off your shirt? I mean, your vest. If
Yes,
it's
yes.
fine with you, can I just see?
Yeah.
Okay. Okay. So I'll start with hands. First, I'll see. First, I'll check if there is any pallors, clubbing.
There is pallor that you can see. There is no clubbing.
Okay. And how's the pulse?
Pulse is like what do you want to look in pulse?
I just want to check with the pulse. How's the pulse is the regular volume
Yeah,
and for normal pulse. Okay.
volume is good.
And okay, good. And then for his eyes, can you just pull your eyelids down and can I just see if there's color or any uh, icterus present? Any-
There is no pallor.
Okay. And icterus,
Uh,
can
you
you
want him
just
to
pull
do
it up?
like,
Yes. Yes.
yeah, no, no.
Okay. And can I just see his mouth?
Yeah, he says ah.
Okay. How is his dental hygiene and any caries present or any
No,
ulcers? Okay. And then, yes. So now, can you, Ravi, can I just have a look at your back?
yeah.
The back seems normal. Then, okay. Okay. I can see hirsutism and, yeah, and short neck. So now, can I just, I would like to measure his blood pressure. Do I have the recordings for the blood pressure?
You can do that later. You can do that later.
Okay. Okay. And I want to do his upper segment and lower segment.
Measurements also you can do later.
Okay, fine. So now, can I just yes, for him now? Yes. Can you just, Ravi, can you just put your hands like this on the side to see how your arms reaches, where it reaches?
Like this is it. How is
Is
it?
it touching?
How do you want to do?
No, no. No. I want to just along your the arms along the side of your body. Can you just put it like that?
Yeah. Okay.
Yes.
Okay.
Does it reach the
And
thigh
how
or
do you-
does it reach?
Yeah. It is at the thigh.
Okay. Can you just put your thumbs over here? Can I just see if it touches the shoulder?
Yeah, it is.
It's touching the shoulder. Okay. So now can you just spread your arms like this in front?
Okay. He's doing like this.
So yeah. So can I see? Hello, Ravi.
Yeah.
Yes. So can you just put out your hands like this?
Like this.
Yeah.
Yeah. He's doing that.
Okay, fine. So and now like this, can you just put your arms like this to see the symmetry? Yes.
3 minutes left. Yeah.
Okay. And yeah. And now can you just make a fist? Okay. Okay. So okay. So I would like to complete my examination by doing the blood pressure measurement and the upper segment and the lower segment for him. So today I got a chance to examine Ravi, who's 5-year-old boy who looks obese for his age, who looks short for his age, and I can see pallor in his hands, and along with it, I can see that he has some dysmorphic facies in the form of this chubby cheeks and some obesity, some interscapular pad of fat and truncal obesity, along with hirsutism. And with all this, I will keep my differentials as Cushingoid-like features, which could be secondary to drug intake or some steroids, iatrogenic cause, or
So how do you want to
maybe.
proceed? How do you want to proceed?
Yeah, I would first of all, I would like to take a complete history, focused history, along with I will first I'll first review his previous papers, and I'll do the vitals, blood pressure, and I'll also do his bedside glucose monitoring, the fundoscopy, and his anthropometry measurements. Uh, and then apart from that, I'll involve my consultant and I'll do the um, investigation. I'll proceed with the investigation to know if he is suffering from progenic cause of Cushing's or maybe an ectogenous cause.
What investigations do you want to do?
Ma'am, I will do first the midline salivary cortisol levels along with the dexamethasone suppression test, low dose and the high dose, and early morning cortisol and early morning urinary cortisol, 24-hour urinary cortisol.
And what multidisciplinary team do you want to involve?
I would like to involve my pediatric consultant and endocrinologist, dietitian, and yeah, and mm, and if he has any other associated risk factors, depending on because maybe if his eyes are involved, then we'll involve
Okay.
the ophthalmologist.
Yeah. Okay. Time is up. Yeah. Okay. General physical examination are usually difficult to do, but I think you got very anxious looking at that command. Okay. How do you feel you did? Others, if you have any positive or negative to add.
Ma'am, in this, shouldn't we be doing the like when the features are obvious like a cushion, so shouldn't we be doing the abdomen also after getting permission to
Yeah,
look for the causes,
we can.
scars or something like that?
And ma'am, will we do
Abdominal side.
Yes.
Ma'am, can we go back to the hands, like start from the hands, then go to the face, then go back to the hands? Like ask her to make the position of the hands like in straight and down and all.
Yeah, what she is
Uh,
doing, short stitcher maneuvers, so that you can do.
We have to do short stitch in this. I'm not sure because I was like, because it's a cushion guide, so it fits in a short stature also, and uh, could be because of hypothyroid or any endocrine causing the short stature. So
You found out Cushingoid, no?
yes, because he had hirsutism and those facies was there.
Yeah, you found out cause for short stature. So, if once it comes to Cushingoid, you either go into doing short stature maneuvers, or you go into doing looking for like the most common cause for Cushingoid disease is iatrogenic cause. So you'll go into looking for why the child was taking steroids, whether the child was an asthmatic or whether the child is nephrotic syndrome. That's why Dr. Lakshmi asked if you should do an abdomen examination.
Okay. So, okay.
Yeah, either way, it is up to you. You can go either way.
Harsha madam, if you have any pro forma for general physical examination, please do share.
Okay. But actually, there is nothing.
Physical examination, I don't know what to do next. Whether you have to do a short stature,
Actually,
whether you have to do abdomen or
Okay.
it was not taught to our batch, ma'am.
No, GP is like very simple. I think even for the other batch we didn't teach. What you do is you do a what we usually do, dysmorphism, dimensions, is the child, are there any devices around, is the child in distress or not, you'll do that. And then you'll do your usual hand and then go up to face, neck. After that, you'll expose the child, see from the front, side to the back, and find out if you're able to find out any positive findings in a general physical examination. If you're able to find some positive findings like this moon facies, the child is looking short, there's moon facies, and then there is hirsutism, there's also interscapular pad of fat. So all this is pointing to Cushingoid. So once you've come to a cause or come to something in a general physical examination, it can just be short stature. Like you're doing a general physical examination, then you're finding your only finding is that the child is short, or it can be that the child is short, obese, and Cushingoid. Or it can be something else. The child will be short with board legs, or the child will only have dysmorphism, something like that. When you do a full front, side, and back evaluation, whatever findings you see, based on that, you'll have to proceed with the further examination. That's why it is general physical examination and proceed. You'll have to pick up what is there from in your head to toe examination, and then based on that, you'll have to proceed. It's just that. There's nothing more to it. So you found out that the child is Cushingoid, so you'll either go into short stature maneuvers or you'll go into looking for causes. If you did short stature maneuvers in your, I would like to complete my examination, you will have to tell that you look for, like examine all the systems to look for why the child was taking steroids, because iatrogenic is the most common cause of Cushingoid disease. Or if you looked for that, whether the child is asthmatic or whether the abdomen is distended, all those, if you went into that, then in your, I would like to complete my examination, you'll say that you'll do the short stature maneuvers. Similarly, if you find some syndromic facies, maybe the child has some port vein stain, then you'll do a neurological examination. Or if you feel that the child has bored legs, then you'll only do short stature maneuvers. And because there is only bored legs and it can only be rickets, you will have to do a head-to-toe examination to look for other features of rickets like widening of wrist or Harrison-Selkers, rickety rosary, frontal bossing, maybe widening of anterior fontanelle, all those, I mean, depending on age. And then if there is still time, they might even ask you to measure height, weight, upper segment, lower segment ratio. So it completely depends on what findings you take from general physical examination, and then from there you'll take your examination.
I mean, rickets, can we go for MSK, P girls and all?
Sorry, why MSK for rickets?
No, P girls, well, rickets, lower limb.
Why?
P girls, no need.
What would you want to look for in P girls?
The walking and everything, joint involvement, I am asking for it generally.
You can try gait and see, because it's general physical examination, like what Dr. Muniza did. She saw hand, face, neck, and then she went on to gait. You can do it that way also. I mean, in general physical examination, you can check gait when you see some findings. But then P girls is not necessary for rickets. For rickets, it will only be short stature maneuvers, and then looking for other features of rickets head to toe. And measurements probably.
Ma'am, in the mock, Balaji sir was saying a code actually, like gate, foot, spine and something. Ma'am, I didn't get the whole thing. So he said he'll later explain for general physical examination. So that was what I was mentioning. I do not know the exact what are things he said? He said gait, foot, spine, and something. Then you will get a clue. Proceed like that.
Okay, maybe he said that so that you look for scars, kyphoscoliosis, all. Anyways, I'll ask him if he something. I'll share that
What
here.
I remember he told was gate, C for the gate, C for the back, spine, C for the foot in the same thing, and C for the neck for any neck swellings. And
Yes.
then you proceed. Then you proceed forward from
Thank
the
you.
hand and all.
Yes.
Okay. It is basically examining the child from the front, from the side, and from the back, so that you don't miss anything. Like adequately expose the child and then look. So when you look from the back, you'll definitely see the calf muscle or the foot if there is any scar, spine if there is any scoliosis or any scar. Similarly, neck if there is any swelling or any scar. And in the front, whatever findings you can get for rickets or whichever.
And ma'am, like you told, obvious condition like dermatological cases, obvious syndromes like Down syndrome, Cushing, Ricketts, Stooge, Weber could be a nephrotic. Any other cases that we can expect in a GPE station?
Short stature, hypothyroidism, like short and there's no other findings, probably there can be thyroid swelling or there can be nothing. But if there is short and you don't have any findings at all in your head-to-toe examination, then you can put hypothyroidism as one of your differentials. I mean, in exam, they've asked hypothyroidism in general physical examination and proceed, Indian exam, I mean, or it can be neurofibromatosis. These are all related to short, or it can be related to tall stature also, like Marfan's or any hyperextensibility or hyperelasticity conditions like Ehlers-Danlos. All those also they can keep. I mean, basically they can keep anything. I mean, it is only going to be Port Weinstein, but you're doing neurological examination and general physical examination, isn't it? Basically, they can keep anything.
For hypothyroidism, how will we go about it? Like, we'll do the thyroid examination for it?
Yeah, if you can find the thyroid swelling, then you'll have to proceed with thyroid examination. If there is nothing that you can see, then you'll only do short stature maneuvers and short stature measurements. And then in your differentials, you'll put hypothyroidism as one of your differential.
Madam, sorry to bother you. Prasanna sir told there is a girl with hypothyroidism in Mumbai. So can you please tell them how to examine thyroid?
Thyroid examination, I think it was covered in the first or second session. You can go back, I mean, Minimoc 1 or 2 somewhere, I think. You can go back to the recording and check.
Okay.
Yeah.
Yeah, it was done once. Yes.
I think Dr. Naresh was raising hands and then he tried to unmute also. Maybe I'll ask him first. You had anything to add, Dr. Naresh?
No, I'm just asking that just like in this scenario, this case is look like a nephrotic syndrome with using the cyclosporine and then followed by this means hypertrichosis and this all these things. So my question is that if such type of the obese babies come in our general physical examination, so we start from the hand, just like the clubbing and cyanosis, and then the pulse, and then scar marks, then go for the lymphadenopathy, and then we see the eyes, and then we go on the back side that between the scapula there is a hump, means the fat accumulation of the fat, then come to the front, then see the gynecomastia, then on the abdomen hepatosplenomegaly, then ascites, then go to the downwards, then we see there is a genu vulgum or genu verum, and then pitting edema. It means as the Dr. Balaji sir is said, then this is a way to we can conclude that this is a child, that if the child is having the pitting edema, definitely there is a collection of the fluid is there. So we can say that this is a case of the I mean the steroid toxicity, and this is not an endogenous, this is a exogenous steroid. So my question is that, so in last we can say I would like to complete my examination detail history, plot centile on the growth chart, including the body mass index, because this child is obese. And I want to do the
Yeah.
upper segment and lower segment and the maneuver of the short stitcher.
Yeah.
So that means the right way to present this case.
Yeah. Proceed with doing the systemic examination. Then in your, I would like to complete my examination. You will say that you want to do short stature maneuver. If you
Yeah,
proceed with doing short stature, then in your, I would like to complete my examination. You will tell that you look for systemic cause for the iatrogenic steroid intake.
yeah. Thank you.
Yeah. So, Dr. Moniza, a few things that you missed. Anyways, you saw the hirsutism, the interscapular pad of fat, the moon phase. Then you could find out that along with short, obese, and all these put together, you thought it was Cushingoid. So maybe there you can ask either your examiner whether that you want to go back and look for other features of Cushingoid disease. You didn't comment about striae, is there any skin atrophy or not? All those other features.
Yes, yes, yes.
Okay, you will have to go back. And one more thing that you can do is just simply ask the child to squat and get up because there will be proximal myopathy in Cushing's. And those
Yes.
can be positive here in hypothyroidism and vitamin B12 deficiency, other than the lower motor neuron lesions that we usually read.
Yes.
Okay, so those will be the things that you'll have to look for also.
Yes.
Okay, if you're proceeding with the systemic examination, then you'll have to auscultate chest to look for wheezing, if at all something is there, or any harsh vesicular breath sounds that you can pick up. Or I like Dr. Naresh said, you'll have to look for nephrotic syndrome, if there is any edema, abdominal edema or pitting pedal edema, whichever you can pick up. Or whatever other causes that you can think of for exogenous steroid intake, you can look for those also. There can also be scoliosis associated. Even in Cushing's, there can be scoliosis associated. So when you look at the back, you have to look for scoliosis also.
Cushing's also have this waddling gait also, right?
Yeah, they can have, or they can even have a limping gait. Because of prolonged steroid intake, there's osteoporosis. Because of that, the child can have a limping gait, or a fracture. Because of that, the child can have limping gait, or they can have a waddling gait, or gait can be normal, like in this child.
Yeah, steroid myopathy is also there.
Yeah, proximal myopathy. Yeah. Okay. Any other doubts? Please do post in group. And yeah. Thank you, everyone.
Thank you, ma'am.
Thank you.